Hello, my name is Beth Kelly, and I'd like to thank you for joining me today as I present my research findings on my study entitled Exploring the Knowledge of BSN Students Regarding the Use of Mindfulness Meditation with a Smartphone App to Manage Stress and Improve Resilience. Stress is defined as when environmental demands, internal demands, or both tax or exceed a person's adaptive resources. Nursing student stress is noted to come from a high academic load, experiencing death and suffering, the demands of a family and of life. Green noted that resilience refers to balancing risks to well-being and resilience factors when experiencing stress. Resilience also refers to a person's innate aptitude for self-change. Isao and Kalaskan in 2022 utilized mindfulness meditation for nursing students entering clinical training. This quasi-experimental pre-test, post-test control group design used mindfulness meditation for 4 hours a week for 4 weeks. Findings from this study showed that the intervention group experienced decreased stress and improved mindfulness. The stress of nursing students is well established in a study by McVeigh et al. 2021. Spadaro and Hunker 2021 explored mindfulness meditation using an online format. They recommended exploration of other modalities, especially the use of mindfulness meditation with the smartphone. So the problem is that it is not known what pre-licensure or Bachelor of Nursing students' knowledge is of mindfulness meditation using a smartphone app to manage stress and promote resilience. The research gap was identified through several studies. Use of a mindfulness meditation use of a smartphone app with nursing students to determine the usefulness was recommended by Spadaro and Hunker 2021. Vidic recommended further qualitative studies to complement his 3 years of quantitative study. Further research to determine students' knowledge of mindfulness meditation and its effectiveness was recommended by McVeigh. Additionally, the AACN published a call to action for academic nurse leaders to promote practices that enhance optimal well-being, resilience, and suicide prevention in schools of nursing across the U.S. Also, the ANA in October of 2022 set forth principles which included nurses offering help and asking for help as part of the norm, and also that nurses can recognize stress injury in themselves and in others. Therefore, the purpose of this qualitative exploratory single case study is to explore pre-licensure Bachelor of Nursing students at one Midwestern university and one Eastern Christian University's knowledge of the use of mindfulness meditation with a smartphone app to manage stress and resilience. Now I'd like to review the related literature with you. There are 4 categories. Nursing student stress is the first. Spadaro and Hunker completed a qualitative study with students in their classes at one university. Students used an online format. Stress was decreased, but the authors recommended that further research be performed to determine the usefulness of mindfulness meditation with a smartphone app. Ibrahim and Kalawa performed a cross-sectional study to determine the anxiety levels in nursing students with chronic diseases. Future research should evaluate the methods of reducing anxiety for student nurses before exams and the use of coping mechanisms. In Franco's study, Lazarus and Folkman's transactional model of stress and coping was used to guide the proposed intervention using a quasi-experimental pre-test, post-test, one-group design. Students participated in a 4-week online mindfulness meditation exercise. Results were significant for the reduction of stress. Franco proposed a study with more than one university in utilizing mindfulness meditation over a longer time. This study provided information for additional research using smartphone apps for student nurses. Core et al. Found that nursing students report extensive stress with clinical classes. The students who practiced self-care were better able to cope with stress, and that preparing students with effective coping mechanisms would help them become more successful. The second category is college student stress. Vidic utilized an unrandomized pretest post-test design to evaluate college students' responses to a relaxation course with a mindfulness meditation component. The findings were significant for decreased stress. The authors suggest further qualitative research to determine more in-depth understanding of students' feelings and perceptions. Galante et al. Conducted a large, pragmatic, randomized control design and found that students benefited from mindfulness meditation and other self-care methods. This study recommended that students use mindfulness meditation and other methods for decreasing stress and increasing well-being. Platt et al. Gave incoming university students a month of free Headspace mindfulness meditation with a smartphone app. Those who used it had a decrease in stress. Those who used it more had better results. Further research is recommended. Bergstaller and Stenson conducted a study which included 5 to 12 minutes a day of mindfulness meditation used for 8 weeks. It was a small group, but it indicated decreased stress, and recommended research was across other majors. Next one is college student resilience. Vidic further evaluated resilience in college students after a relaxation course that included mindfulness. Resilience was significantly improved in this study. Galante also included resilience in their study and found that mindfulness meditation improves students' resilience to stress. These authors suggest high-quality comparative research between mindfulness and other methods. This research added information for further research. Finally, Window of Musselman's cross-sectional pilot study provided information on the usefulness of stress management education, which included mindfulness meditation. Findings showed that students learned to manage stress and were more resilient even a year later. Students commented that the course also taught them time management. And finally, stress management knowledge. McVeigh et al. Completed a qualitative survey study that was designed to determine nursing students' knowledge of mindfulness meditation and if they would like it in the classroom. Students indicated that they did, but more research was recommended to determine if a smartphone app format would be helpful. So this brings me to the theoretical frameworks that were used for this study. First was Lazarus and Folkman's transactional model of stress and coping. Threats, cognitive and emotional functions were studied or addressed in this theory, and were used by an individual to determine if a threat was present and choose a method to cope with that threat. Threats could be something that would cause harm, threaten a person's well-being, or provide a challenge to address. The three-part model consists of appraisal, reappraisal, and coping. Appraisal involves the instantaneous reaction to the event. Reappraisal happens right after appraisal and refers to the person continually evaluating the event and determining what it means to them. Finally, coping occurs and is affected by a person's beliefs and background, which determine the method of coping. Cognitive function determines the emotional reaction to a stressful event. The next framework was Vygotsky's zone of proximal development. According to Vygotsky, learning is a developmental in nature and constitutes two zones, the actual and the potential. Actual development is determined by one's prior knowledge and experience, which for the constructivist educator is considered the starting point to advance knowledge and thinking skills. The proximal zone, an extension of the actual zone, marks the space between the students are capable of doing with assistance and what they can do independently. Part of This zone is technology and tools. And so the smartphone app fell into that part of the category. This leads me to the significance of this study. In this study, I explored the gaps that were identified in previous studies regarding BSN student stress, resilience, coping mechanisms, and their knowledge of the use of mindfulness meditation to manage stress and promote resilience. Now I'd like to present my research design. This design was an exploratory single case study design. The three methods of data collection were used to allow for triangulation and transferability of findings. The methods of data collection are inexpensive and designed to take up as little time as possible in the student's schedule, yet still obtaining a thick and rich description of data while utilizing the available populace. To obtain participants, classes were visited in person, given information, and provided a QR code that took them to the informed consent, surveys, and the demographic questionnaire. After this, students were asked to volunteer to participate in Zoom and in-person interviews or focus groups. How did I collect this data in a reliable way? The demographic questionnaire was constructed based on the normal national census data form. And ethnicity was also gained via the demographic questionnaire. This study had two phases. First, I learned about the context of my participants through surveys. These surveys provided descriptive information that was useful in understanding the context of the interviewees and further useful in allowing the researchers to engage in thoughtful, probing questions during the interview. The second phase was interviews and focus groups. Following are the surveys that I used. I used the Perceived Stress survey, which asked questions about feelings and thoughts during the last month about stress levels, which will provide information to the participants' stress levels. This information was helpful for the stress questions in the interview and focus groups. Next, I used the Brief Resilience Scale. The purpose of the Brief Resilience Scale was noted by Smith to be a scale to measure the most fundamental meaning of resilience, which is the ability to recover from stress. This information was helpful for the resilience questions in the interviews and focus groups. And finally, I used the Mindfulness Awareness Assessment Survey. This was designed to identify the inter- and intrapersonal differences in an individual's mindfulness capacities. Brown and Ryan described mindfulness as consciousness that includes awareness of the present surroundings and attention to the current moment. This survey provided information on the students' present mindfulness and helped them to understand the mindfulness question in the interviews and focus groups. So my data collection and analysis, the flow was recruitment followed by surveys, leading to interviews and focus groups, which were scheduled and performed and then transcribed, which led to thematic analysis of the data that was received. So now let's discuss the findings of the study. The participants' ages were generally between 19 and 20 years old. Their gender was 92% female and 7.7% male. That was lower than the national average gender distribution of 12.6. 81% of participants were white, 5.5% were Asian, and the rest, multiple nationalities, had just small percentages. So now I'd like to review the themes that were discovered with you. Varying definitions of mindfulness. Mindfulness was noted by some students as attending to others, such as showing thoughtfulness and being thoughtful to their needs. Mindfulness was also described as being alert to what's going on around you, aware of your own actions, and trying to maintain balance in your life. Further, limited understanding as present awareness was noted. Students were self-aware, knew when they needed to take a break and keep thoughts from wandering. That's how they described mindfulness. Next is knowledge and attitudes towards smartphone apps. 3 participants had meaningful exposure to mindfulness meditation. The remaining 22 had little exposure to meditation and therefore did not have a clear understanding. 4 participants had the opinion that mindfulness meditation was associated with Eastern religion or New Age religion. Eastern religion includes Buddhism, which is well known in culture, even though mindfulness started in India and China. The Buddha referenced mindfulness as a direct path to being free from suffering. New Age religion includes meditation, but is noted by one participant to include crystals and varying beliefs that do not focus on God. Further, in knowledge and attitudes towards smartphone apps, all participants felt that instead of mindfulness, they would prefer to meditate on the Bible and God's Word. 5 participants had positive things to say about mindfulness and its helpfulness. They agreed that they hadn't heard anything negative at all about mindfulness meditation. Next is the attitudes towards smartphone apps. 6 participants had exposure to health and well-being smartphone apps. Prior exposure to the participants is limited. It mostly comes from knowing someone who used a mindfulness meditation smartphone app. All unexpected common theme for 4 students was that they were trying to stay away from using anything more on their smartphones. Tabitha felt that it made her more anxious and noted that a mindfulness meditation in class might be better. Students had very little knowledge of mindfulness meditation using a smartphone app. All participants had some small exposure with or without a smartphone app. One student had a boyfriend who meditates, but she didn't know what method he used. Additionally, another participant did note that she thought mindfulness meditation with a smartphone app was commonly used in the population today. Another participant noted that she didn't feel that mindfulness meditation with the smartphone app was tailored to her personal needs. Further, very little knowledge of mindfulness meditation. However, students did know brand names. 7 participants discussed being aware of specific mindfulness meditation smartphone apps. Headspace was the most commonly mentioned. One participant noted using an app called the Happiness Project, and another participant mentioned the Hallow app, which is a Christian devotion app. The next theme was prior exposure to methods presented in mindfulness meditation. So one method that is included in mindfulness meditation is the body scan, and 2 participants had used that in the past based on parental recommendations. 6 participants has used breathing mechanisms, with box breathing being the most popular. Further, mindfulness minutes was noted to be used by one participant. She noted that it was used in the classroom before something stressful like an exam. And lastly, devotion time. All participants used devotion time, which they named as helping them relieve their stress. 4 students noted prior experience with mindfulness, either experienced personally or by someone that they knew. Delaney had friends who recommended it to her, and she appreciated it after trying it. Kanya had the experience of participating in a study where students completed mindfulness with an instructor. Additionally, Jalen had a clinical experience that was group meditation led by an instructor. And finally, Katrina experienced high school counselors who led a group meditation. Next, there are challenges of nursing school. Students know that having the time in nursing school to do mindfulness meditation with a smartphone app is a problem. Most students felt that they had so much coursework to do that fitting in another task was difficult. The idea of self care was not often valued in these participants. For students noted that difficult coursework was a big stressor in nursing school. Tabitha addressed the difficulty of nursing school with higher standards of work expected. Further, several participants discussed the difficulty of dealing with clinical experience and the stresses involved. Eileen felt that having mindfulness meditation with a smartphone app could help a nursing student transition from the difficulty of clinical days to going home and not taking your difficulties with you. Next was perceptions of the use of mindfulness meditation with a smartphone app. 6 participants have heard of mindfulness meditation with a smartphone app for resilience and stress and agree that it would be helpful for nursing students. Delaney shared her experience. I think the app is nice because I can look at it as I'm doing it and it's guided. I'm not all on my own doing it. Next was resilience in nursing school. 5 students reported thinking back to the reasons they entered nursing school to build up their resilience to the difficulties they experienced during school. Eileen noted remembering why she decided to become a nurse, while Samantha appreciated the good parts of nursing school, such as meeting patients, to improve her resilience. 4 participants promoted their resilience by organizing their time so they could accomplish all that nursing school required of them. Erin appreciated a wellness workshop that the school offered to improve resilience. Additionally, Erin made lists to become organized with her time. Further, Shelby felt her resilience was improved when using specific study habits. Next is managing stress and resilience. All the participants spoke of resilience enhancement because of things that the instructors did for them. Laura discussed that professors affected resilience greatly with devotions and helping students to see that their strength comes from God. Kanya and Samantha echoed these sentiments by noting that instructors are helpful and encouraging. 5 participants indicated personal relationships that improve their resilience. Keisha noted that having an unshakable faith assisted her in gaining resilience in her personal relationships. Hope and Emma felt that they gained resilience from the people they surrounded themselves with. 4 participants discussed improving resilience through a reliance on God. Eileen felt it was important to remember her love for Christ. Further, Samantha noted that nursing was God's plan for her life and that would strengthen her resilience to continue and be successful in nursing school. Finally, Katie improved her resilience with praying, and Samantha drew strength from Bible reading. 3 participants addressed using mindfulness meditation techniques to improve their resilience. Katie used grounding techniques to help her with stress from exams. Erin attended a wellness workshop at school. And Keisha noted the mindfulness meditation techniques were available, and she had a strong desire to learn them to improve her resilience. Now, the results from the surveys. The perceived stress scale, notable findings. The highest score is 40, and the scores from these students were mostly in the middle. So, this points to a need for a method to manage stress. Next was the brief resilience scale. Again, most of the findings were in the middle range. However, the lowest range had 15 participants, which was higher than expected, indicating low resilience. So mindfulness meditation has been shown to improve resilience and could help these students. Finally, the mindfulness awareness assessment survey. The scores were evenly distributed throughout the scale. A third of the students showed low mindfulness. Mindfulness meditation has been shown to improve mindfulness. The students have a poor understanding of that, so improving their understanding and providing mindfulness meditation could improve their mindfulness. Now I'd like to discuss the questions with you. Sub-question 1A, What are the experiences of pre-licensure BSN students with mindfulness meditation and smartphone apps? There are varying definitions. Mindful is attending to others, mindful is being alert. Smartphone attitudes, some were trying to limit the use of the smartphone. One student thought the guidance of a smartphone app was helpful. Some had used it for sleep, and some used devotions. The second question, what do pre-licensure BSN students know about mindfulness meditation using a smartphone app to manage stress? There was little knowledge of mindfulness meditation smartphone apps amongst the students. 3 students had used mindfulness meditation with a smartphone app. The remainder of students had heard of a smartphone app, or they knew someone who maybe used it. Their exposure to mindfulness. One student thought mindfulness meditation with a smartphone app use was common in today's population. 2 students liked it when they did use it. One student found mindfulness meditation with smartphone apps were not tailored to her needs. And the final question, what do they know about mindfulness meditation using a smartphone app to promote resilience? There were challenges in nursing school, time management, difficult course load, clinical classes, and resilience in nursing school. Students found this from being organized, instructor relationships, relying on God, and remembering reasons that they started nursing school. So it brings me to the recommendations of future research. Future research should include multiple Christian universities. It should compare a Christian university with a secular university. Also, quantitative research that employs the use of mindfulness meditation with the smartphone app with nursing students. Recommendations for future practice. Mindfulness meditation activities should be included in the classroom. Encourage self-care activities for nursing students. And to do these things, the education of nursing instructors is necessary in the use and benefits of mindfulness meditation. There were limitations. There was a lack of general knowledge regarding mindfulness meditation with the smartphone app. The study only included one Christian university, and there was a general lack of knowledge of mindfulness meditation with the smartphone app, which limited answers to some questions. This study and the prior literature indicate that nursing students still have high stress levels and need encouragement to use mindfulness meditation with the smartphone app to help relieve stress. Educators should follow the ethical standards set forth by the AACN and the ANAE to help students reduce stress. I learned from this dissertation process how effective mindfulness meditation with the smartphone app can be for stress management. I plan to continue to work with nursing students, teaching this method of stress relief to them. I hope other educators will do the same. Thank you.